The following slides will show a small example of what occupational therapists can do for their patients to create the best possible situation for independence within daily activities. A is for ADLs, which means activities of daily living. The focus and main occupations OTs address includes bathing, dressing, feeding, and so much more. B is balance. Occupational therapists are concerned about the safety of the patient. If the patient cannot safely transfer from one spot to the next with good balance, then they would require more OT. C is for cancer, a disease which occupational therapists provide treatment to a patient through managing ADLs and health and lifestyle management, therapeutic exercises to address range of motion and strength, patient education on adaptations and compensations to the overall lifestyle, and so much more. D is dressing, one of the ADLs that is addressed by an OT. It is an important part of everyday life that an OT gives the patient the assistance and tools to become independent with this task. E is equipment, or adaptive equipment. Adaptive equipment is utilized by occupational therapists to modify the task or environment for an individual to promote independence. F is frames of reference. Frames of reference are the basis for the approach an OT takes towards treatment planning. The type of setting an OT works and the different type of patients and how they present will determine the frame of reference used for evaluation and interventions. G is goals. Goals are important for the OT and the patient to plan and meet so progress can be noted and discharge can be achieved. H is handwriting. Handwriting is an integral part of OT in the school systems. It is necessary for child independence with classroom work, fine motor skills, and visual perception. I is IADLs, which means instrumental activities of daily living. This is another important focus area for occupational therapists. These are the next step of functional tasks an OT will address, and they include driving, meal prep, home management, and so much more. J is for justice, or occupational justice. Occupational justice is a term that emphasizes rights, responsibilities, and liberties that enable the individual to experience health and quality of life through engagement in occupations. Individuals must have adequate supports and resources to participate in those meaningful occupations that occupational therapists can offer. K is kinesthesia. It is the awareness of the person's body movements and position through sensory organs in the muscles and joints. These organs are referred to as proprioceptors, which is a client factor that can be affected by sensory disorders that OTs provide treatment interventions. L is low tone. This results in poor posture and difficulties with movements. Occupational therapists provide early intervention treatments to children with low tone through exercises, adaptations, and parent education to get their children stronger and moving. M is modify. This is an approach to OT intervention in which adaptation or compensation is used to enhance the abilities of an individual to promote independence. N is NBCOT. This is the national certification for all OTs. An occupational therapist must pass this exam in order to receive certification. O is occupations. Occupations are what draw the focus of OT. Occupations are the everyday events in which you participate. They can be ADLs, IADLs, education, work, play, leisure, and social participation. These are the essential areas that OTs provide treatment. P is PEO model. This theory is an established approach the OT takes towards providing effective treatment for their patients. PEO stands for Person, Environment, and Occupation. It incorporates a holistic viewpoint for treatment. Q is quality of life. Occupational therapists provide treatment to improve the overall health and quality of life for their patients. Independent functioning is guaranteed to produce a higher quality of life. R is range of motion. Range of motion is measured and increased by the OTs for patients that suffer stroke or orthopedic injuries that develop contractures or inhibit functional mobility of specific joints or muscles. S is safety. This is the highest priority for occupational therapists. Safety with occupations is important to prevent further disability and promote independence for a patient to be discharged from OT services. T is tactile defensiveness. This is a sensory concern where an individual has increased sensation to normal stimuli and reacts to it in a painful manner. OTs work in this area to habituate the patient to these sensations to decrease the negative reactions to them. U is universal design. This is a concept where all buildings and tools will be accessible by those with disabilities. It is supported by occupational therapists so that an individual with a disability has easier access to their specific needs. V is vestibular functions. These are one of the unknown sensory functions to the non-healthcare world. This sensation is related to balance, position, and movements against gravity. Disabled vestibular functions interfere with the performance of daily functioning and occupations. W is wheelchair. The wheelchair is often used by rehabilitating patients receiving OT services or by those who depend on it for an extended period of time. It is a piece of equipment that needs specific measurements for best patient fit and environmental modifications for the home. OTs must know the ins and outs of the wheelchair to instruct the patient for proper use and to prevent skin breakdown. X is X-linked disorders. Related disorders OTs treat to provide the patient with increased independence with functional performance, parent and patient education, and community integration. Y is youth. This is an influential population OT treats. They are provided OT services in outpatient, inpatient, and school settings. Proper child development is essential for sustained growth and functioning. The OT is influential to providing these abilities for the child. Z is zone of proximal development. This is an area of functioning between the child's capabilities and disabilities. The OT can provide the child with the right tools and support to give more independence and capabilities through scaffolding with activities. Occupational therapists can work in a variety of settings ranging from inpatient to outpatient, pediatrics to geriatrics, and home health to mental health. Occupational therapists address all of these things and so much more. Share this video and discuss what an OT can do for you.